É um prazer estar aqui com vocês neste fórum, nono encontro de Fórum DCNTs. Bom, vamos começar então. Chamo-me Cristina Parsons-Perez, sou diretora de desenvolvimento de capacidades na NCD Alliance, e para o painel hoje queria partilhar um pouco sobre as nossas preocupações globais para o combate às DCNTs neste panorama que estamos vivendo neste momento de pandemia global. Peço desculpa, vou apresentar em inglês, depois para as perguntas e respostas posso falar em português, mas vou apresentar em inglês se não se importam. Next slide, please. Ótimo, então sorry, I'm just going to share a little bit about who the NCD Alliance is. We are a civil society organization, a membership-based organization, and it's actually a pleasure to note that Fórum DCNTs is a member of the NCD Alliance. So we were founded in 2009 by the different federations, global federations working on NCDs by burden. So the Union for International Cancer Control, the World Heart Federation, the Union for TB and Lung Disease, and International Diabetes Federation. We work with 26 partners funded through private sector, foundations, bilateral agencies, NGOs, and we have this kind of exciting, growing membership network across the world. And I just want to note this exciting growth of NCD civil society. At the latest count, we knew of 66 national and regional NCD alliances, so really kind of providing these platforms for unified civil society action. Next slide, please. So we just put out as an organization our new strategy. We basically obviously work to unite civil society to drive action on NCD prevention and care, leaving no one behind. We align behind different agreed upon global targets on reduction of NCD mortality. And we also look to having an impact in 4 areas that we've identified as major gaps in the NCD response: prevention, care, financing, and community engagement. We're well known for our advocacy and accountability work. We also work in capacity development, so supporting civil society at national and regional levels in their advocacy work, generation and exchange of knowledge, and also partnerships. These are the different pillars of work as an organization. Next slide, please. So I'm very excited to be able to share with you today some of our thoughts around a global NCD agenda for resilience and recovery. And Renato already was sharing some really pertinent thoughts there with regards to mental health. So kind of in reflecting on the syndemic, this idea of kind of colliding pandemics, COVID-19 and NCDs, we've put together this agenda for our advocacy work for governments and key stakeholders on building back fairer from COVID. So this point of a syndemic is a really, really interesting one. I have a quote here by Dr. Richard Horton, the editor of The Lancet, and really noting that we basically see the colliding of these 2 pandemics, so 2 categories of disease interacting within specific populations, and against this background of really deeply rooted social inequalities. We know that the majority of COVID deaths have been of people living with 1 or more NCDs. We know of those unique vulnerabilities of people living with NCDs to severe outcomes from COVID. And really what the COVID pandemic has showed us all really is how, it's revealing the health of our populations, and it's really revealing that exposing acutely that lack of progress that we have seen on addressing NCDs. We know that before the pandemic, less than 20 countries worldwide were on track to reduce premature NCD deaths by 1/3 by 2030. Renato showed some data on disruptions to mental health care services. And from work that WHO has done, we know that nearly half of countries are reporting disruptions to one or more services for NCDs. So it's not just that people living with NCDs are uniquely vulnerable to COVID. We're also seeing severe disruptions to the essential care that people need. Next slide, please. So this notion of our global agenda on resilience and recovery, next slide, please, divides recommendations into three different areas: governance, prevention, and health systems. So on the governance front, I think it's a key thing to share here that perhaps unsurprisingly, one of the first recommendations is the notion that we have to be including NCDs in COVID response, recovery, and preparedness plans. The 2020 COVID-19 Omnibus UN General Assembly resolution stated very clearly, this is of course, negotiated with all different countries agreeing to this. This resolution states that governments commit to further strengthen efforts to address NCDs as part of universal health coverage, recognizing that people living with NCDs and those exposed to major risk factors are at a higher risk of developing severe COVID symptoms and are among the most impacted by the pandemic. However, we really need to see more progress in this area. We know that only 16 countries have reported to actually have NCD management and essential health services included in national COVID-19 response and recovery plans. So this is an essential area for improvement and traction. And part of this involves this kind of new redefining on how health security and pandemic preparedness is addressed and measured, closely tying in with this notion of including NCDs into that COVID response, into COVID response planning efforts, is this notion of it is absolutely essential that we involve the community in decision making. And if I can share here, that the independent panel on pandemic preparedness and response found that the most successful national responses to COVID have been those that engaged with local communities to build resilient health systems and to inform service delivery, decision-making, and governance to meet community needs. The bottom line really is that when policies, programs, services are designed with those that they are meant to be served, we know that they will be more effective and impactful. And so this is a really, really essential aspect of community engagement in the COVID response. And given the unique vulnerabilities of people living with NCDs, this is where we need to see those voices coming forward. Brazil, of course, has a really interesting track record in social participation, health service design, conselhos de saúde, of SUS, all of that infrastructure. But I think one important aspect on community engagement, building public trust, is also this notion of that we're living in times of really shrinking civic space. So really needing to ensure that civic space exists and that those social participation mechanisms and ways of really bringing those community perspectives are maintained and safeguarded and seen as an essential enabler to an effective response and recovery to COVID. Next slide, please. So as part of this, we obviously need to be looking at the kind of the investment case for NCDs and really seeing these connections with security and equity. And so investments for the pandemic response, we cannot see these creating another disease-specific silo, these kind of vertical approaches that exacerbate inequality and inefficiency. I think what we're really seeing here with the pandemic is this kind of blurring of lines, that non-communicable diseases have so many connections with communicable diseases, and as such, we really need to be seeing that as part of these investment cases for public health and NCD policies. So really looking at those kind of wider health co-benefits, benefits for development, but also looking at co-benefits in terms of prevention of comorbidities, those kind of interactions between diseases. And so investment cases, cost-benefit analysis, we really need to be seeing them reflect this value of improved security and resilience to these challenges in pandemics. Next slide, please. And as part of governance, really at the previous slide, please. At the heart of governance is this notion of addressing conflicts of interest and power imbalances. And so the pandemic has shown us this really kind of, I think, has accelerated our recognition that imbalances in power still unduly influence decision-making, and that putting short-term economic interests ahead of public health is costing us lives and livelihoods. And so one aspect here is the notion of unhealthy commodities. So we're very much looking at ensuring healthy environments for healthy populations, looking at NCD prevention and looking at regulation. And so specifically looking here at taxation of unhealthy commodities, phasing out health harmful subsidies. And I know that there's a lot of good work happening in Brazil in advocacy in this area. And ACT Health Promotion is one organization doing work on very much on fiscal measures and taxation. I have a link here, I'll put it in the chat, a paper that was out just this week, just 2 or 3 days ago in the Lancet Global Health, and they look at implementation of NCD policies. And they have one interesting finding there, that democracy was positively associated with policy implementation, but only in countries with low corporate permeation. And I think that the point to be made here is just really ensuring that we have robust governance mechanisms so that we can be sure that regulation efforts are not affected by unhealthy commodity industry interference. Next slide, please. And so linking the previous slide, please. So linking to this is this notion still on prevention, really, that we need to see, kind of pivoting towards prevention and seeing a shift of health leaders towards achieving healthier populations with resources, political capital invested. And so these recovery policies really need to be looking at achieving step changes with societies and environments that promote health and well-being, and that maintaining and improving that population health is going to guard us against future health threats and reducing the costs of future health crises. Combating inequalities through better social protection is essential. And again, that notion of syndemic and this colliding of pandemics against a background of deeply rooted inequalities. So we really need to identify those inequalities and who is left behind in efforts to improve health systems and health services and care, and look to dismantle those barriers with laws, policies, and social protection programs. There's a couple of other recommendations that I just wanted to share here now, really looking at health systems. And so the recommendations that we have as part of this kind of global NCD agenda on resilience and recovery regard that idea again of not seeing silos and not having kind of a vertical approach, but looking at those connections across the board and integrating NCD services into the pandemic response and beyond. We have seen a lot of innovations with the COVID response, reducing the need to visit healthcare facilities. We've seen telehealth consultations, home visits by community health workers, multi-month prescriptions, home delivery of medicines, and support for self-care. And so many of these are absolutely essential and important for chronic care required for NCDs. So it's a key here that we're looking at reconfiguring health systems for that early detection, diagnosis, and care for NCDs, as well as other chronic conditions. And I think Renata was very much touching upon this, the need of strengthening primary healthcare services for addressing NCDs, and of course, mental health very much as part of this. And I think here the opportunities that we have seen with rollout of large scale initiatives as part of the COVID response. And, we need to be looking at these as how can we use these for opportunistic screening, and those kind of diagnosis opportunities for NCDs, raising awareness of risk factors, for example, as well, and looking at those, kind of the delivery of COVID vaccine as an opportunity for addressing NCDs as well, that integration of programs. And my final slide next, which is again looking at the COVID response and looking at resolving bottlenecks in supply chains. This is something where we've seen that COVID vaccines were developed very, very rapidly and produced at this, really impressive speed and quantity. But we know that that supply chains are one of the issues that can hinder the rollout of the vaccine. And we know as well that prior to the pandemic, that essential medicines and technologies for NCDs were insufficiently available at health facilities. And we know that most low and middle income countries are actually really not on track to reach this 80% target of availability of essential medicines and technologies for NCDs by 2025. And we know that weak supply chains are one key barrier to access for NCD care in low and middle income countries. Some interesting work by the organization PATH on No Empty Shelves, where they were looking at barriers on access to medication for diabetes. And one of the challenges found there was exactly this point of supply chain. And within this, and we have seen this with the rollout of the COVID vaccine, the need for cold chains, or this, kind of temperature controlled supply chains. And this is one of the challenges that we face, for example, with the supply of insulin. So there are opportunities here in looking at these kind of synergies between that COVID response and opportunities to improve our response to NCDs. Next slide, please. I'm just going to leave you with this really quite powerful quote from Professor Sandro Galea, saying that we cannot waste a moment in shaping a society without the vulnerabilities that hindered our COVID response. And we know that NCDs were definitely one of those vulnerabilities. Thank you so much. Over to you, Johannes.